Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please let me know in the comment section. Beautiful evening to the beautiful people on this planet. So, yes, $1 million face. Can you see $1 million face? Any idea? Guess the face. Who am I? My name is Dr. Anand. And yes, the life is really beautiful. Is my voice audible to everyone? Please let me know quickly. Is my voice audible to everyone? Yes, it is audible. Great. Good evening, Dr. Mansi Panulla. And what do you call it? Yes, exactly. New haircut. Nahi, I just came back from gym. 1 second. I just came back from gym. That's why my hairs look like a new haircut. But I was born amazing. That's a different thing. Good evening, everyone. A beautiful evening. Today is the last class of this week. Today is Friday. Tomorrow is my night duty, and tomorrow is Saturday. Saturday I'm not there. Sunday I'm not there. Sunday we are starting classes also. Saturday, Sunday, Gautam Nagar, Delhi, pediatric rapid revision classes for 3 days, and some 300, 400 students will come. If you're free, you also come. It's amazing. Good evening, beautiful people. Yes, my name is Dr. Anand. I've done my MBBS from Rajiv Gandhi University Health Sciences, Bangalore. Then I did my MD in pediatrics. Then I did my SRship from NC Joshi Hospital, Lady Harding Medical College, Hindurao Medical College. Then by mistake, I became an assistant professor. There was only one vacancy. My HOD had told, and by mistake, seriously by mistake, it happened, and I became a AP on 10th of March. I remember, and 11th March was my birthday. I was very happy, and till today, I am really happy. And we teach to beautiful students of MD and DM and students applying for MRCPCH because we have some beautiful, what you called God gift of teaching in a beautiful way. Life is amazing. I want you guys to breathe, live, and enjoy every single part of life. Before starting any amazing segment, we always have a motivating quote. And today's beautiful motivating quote is: failure is not the opposite of success. Failure, it is not the opposite of success. It is the part of the success. That's very important. Failure will teach you someday. Okay, there was a nice quote. No, we were reading a few days back. Then if you win, if you it's a nice quote. If you win, you can lead, but if you lose, you can guide. Do you agree with me? Yes or no? It's a very beautiful quote. If you win, you can lead. If you lose, you can guide. So it's so beautiful, right? So anyhow, it's gonna be helpful. Life is amazing. Life is beautiful. Failure is teaching us. People who are ditching us, they are teaching us. People who are abusing us, they are teaching us. People who are saying bad around behind our back, they are teaching us. People who are appreciating us, they are teaching us. People who are जो हमारी निंदा करते हैं उनसे भी हम सीखते हैं, और जो हमारी प्रशंसा करते हैं उनसे भी हम सीखते हैं. So in short, life is a beautiful journey. It's how you take. You want to take things in a bad way, things will be bad. You want to take things in a light way, things will be light. And a very $1 million quote we always say in Hindi कि बड़ी बात को छोटा करो, like बड़ी बात को छोटा करो, छोटी बात को कॉटन की रुई की तरह बनाकर फूक मार के उड़ा दो. जिंदगी ऐसी होनी चाहिए. Today's beautiful class we're gonna talk about. We have to finish the torch profile and gonna enter the next topic. Dr. Shubham, good evening. Isra Mustafa, good evening. Sharon MS, good evening. Yes, so Dr. Suman is right. If you win, you will lead. If you fall, you will rise. And if you lose, you can guide. So anyhow life is beautiful. It is just how you take it and just how you see it. कहते ना जब जागो तब सवेरा. If you feel life is beautiful, if life is beautiful, if you feel if you say what, there's nothing great in life, it's just a regular day, bro, just a regular stuff. If you think that way, things gonna be boring. And that's what. And Shubhangi and Osama and Amrit and what do you called Osama, I'm gonna will go live 10:45. These people they do chit chat on Instagram. I think WhatsApp. I'm gonna go live with them, like just for fun. If you guys are free, you also come. FMG and AIMS question number 1. Let's quickly do some beautiful studies. Today we have to finish torch profile. Torch, we all know toxoplasmosis, others rubella, cytomegalovirus, and herpes. We were only left with one beautiful triad, that is rubella. Rubella in the last class, yes, we have done, as everyone knows. AIMS entrance question number 1. What is the other name of congenital rubella syndrome? The answer is Gregg syndrome. FMG question number 2. Which is the most severe form of intrauterine infection? Again, the congenital rubella syndrome is the most severe form of intrauterine infection. Congenital rubella is most effective in which trimester? Can you answer in the comment section, please? Yes, Dr. Grace. Beautiful. Saroj Anand. Yes. So as you all know, that rubella basically is very much effective, serious in the first trimester. Parvovirus B19 in the second trimester. trimester, and whosoever left toxoplasmosis and this and that and syphilis, they are very prone in the third trimester. That part we have already done in the previous class. And also one very beautiful, yeah, this is also one beautiful point we have done, that if the mother, yes, exactly, if the mother in the first trimester, if she has got a congenital rubella infection, how many percentage chances are there the baby will be defective? The answer is beautifully 90% chances are there that the baby will be defective. And also at the same time, if the baby is 11 to 12 weeks if the mother is 11 to 12 weeks pregnant, then only there are 33% chances of having the defect. The only very important exam entrance question is this only, that if the mother is less than 11 weeks, if the mother is pregnant and she is less than 11 weeks period of gestation she is having, there are very high chances the baby will be defective. That's it. Yeah, and we have done the mnemonic. Yeah, this also in the last class we have done that usually the congenital rubella syndrome patient behave like measles. The only difference is the measles will have a fever with rash on which day? Any idea? Normally the patient of measles will have a fever with rash on day 4, which goes behind the ear and the face and the trunk and the whole body. And beautifully we know it is a measles is a centripetal rash or a centrifugal rash. Can you answer in the comment section? That is the beauty of the live classes. We try to participate as much as possible. See, every different app has all the recorded sessions. Okay, what is the difference over here? Over here is we talk, we participate, we chill, अपनी बेइज्जती कराते हैं हम गलत आंसर देके, और फिर हम खुश रहते हैं सारी उम्र. So yes, tell me bro, what do you think guys? My question is that measles will have a centripetal rash or a centrifugal rash. Can you please answer quickly? And गलत आंसर दे के दिखाओ. हाँ जी. Beautiful, beautiful. Dr. Grace says that measles will have a centrifugal rash. Okay, beautiful answer. Can anyone else answer in the comment section, please? Okay. Hennebert also. तुम्हारे नाम है स्वर्ण अक्षर से लिखूंगा. Your name will be written on the golden plate letters. Okay, centrifugal. Hennebert says. Okay, Suman also says Hennebert. Beautiful. Such delicate students we have. और कौन है महान हस्ती? Okay. Hennebert says fugal, Suman says fugal, Grace says fugal. Please remember, Mahan Admi and Ortho, please remember, gentlemen, sweet people, that what is the meaning of centrifugal? First of all, please remember, centrifugal का मतलब होता है, centrifugal means that the rash is everywhere, but the distribution of rash is more towards the periphery. F for fugal, F for far areas, like this hand. मेहंदी लगाऊंगी मैं सजना के नाम पे, वो था ना गाना. So like the hand and the feet. Okay, so centrifugal means F for fugal, F for far as in the distribution of the rash is everywhere, but the distribution of rash is more towards the periphery. And measles, frankly speaking, measles, मरने से पहले please याद रखें तुम तीनों, Grace and Suman and the other one, measles is a centripetal rash. Measles is a centripetal rash. Thank God I asked this question. You know, sometimes I think that I should not ask you questions because I thought you already know it. I always have this overall thing that you know the answer, so it's fine. Then why to ask you the questions? But good, I asked. Good, I think it's good I asked. So will you remember, all three of you? Hello, Mahan Hasti, big people. Measles will have, very importantly, centripetal. पेट की तरफ ज्यादा होता है. It is more towards the center where I have my 4 abs, which is going amazing. Thanks to my instructor. And yeah, so measles will have a centripetal rash. The distribution of the rash is more toward the tummy area. Even chickenpox, can you quickly answer in the comment section? Chickenpox का rash कैसा होता है? Centripetal or centrifugal? Yes, very beautiful. Remember, centripetal. So chickenpox, centripetal. Measles, centripetal. Even roseola, so many other diseases have centripetal. Centrifugal, any idea? Centrifugal. Dr. Osama, तेरा आंसर किधर है बेटा? हाँ जी, डॉक्टर ओसामा. सूरज कुमार से आई जॉइंड लेट. यू जॉइंड लेट, तुम्हें 100 कोड़े मारे जाएंगे. ओके. करण क्या कह रहा है? मेरा दिमाग कुछ और ही आया था सर जब पढ़ा. ओके, कूल. हाँ जी. Centrifugal will have HFMD. Can we be beautiful think about hand, foot and mouth disease, and even what you call अपना वो वाला that rocky spotted fever, that is because of rickettsia. You know, scrub typhus. No, scrub typhus also can have kind of a palpable purpura, and scrub typhus, which is caused by rickettsia tsutsugami. I'll repeat again. Scrub typhus is a beautiful disease where the patient will have a fever with rash on which day? शुभांगी कहाँ पे है? शुभांगी, in scrub typhus you see fever with rash on which day? Can you please answer in the comment section? Shubhangi, I'm looking at your comment. Your comment is not coming. मरने से पहले आंसर दो बेटा, वरना घर पे आके मैं बताऊंगा तुमको. Okay, beautiful. Yes, Karan का है. Okay. Himlata, okay, okay, okay. What's the answer, bro? What's the Shubhangi? I'm not able to see your answer. Fever, scrub typhus. Scrub typhus, you will have fever with rash on day 5. Doctor, today I've got a fever. On after the 5th day of the fever, I will have fever with rash on day 5, seen in scrub typhus. Fever with rash on day 6, seen in dengue. Day 7 is apna typhoid fever. And fever with rash on day 5, which is nothing but scrub typhus, which is nothing but a rocky, this क्या बोलते हैं इसको जो लिखा है इसने, rocky mountain spotted fever, nothing but a scrub typhus is caused by rickettsia tsutsugami, where the patient will have fever with arthritis with palpable purpura. Palpable purpura, please remember, it's a differential diagnosis. Palpable purpura you will see in ITP also, idiopathic thrombocytopenic purpura, and also palpable purpura is seen in very importantly in a case of scrub typhus. So same palpable purpura and kind of a HFMD picture, like peripheries, hand, foot and all, hand, foot, mouth and all that. So that's why centrifugal, the examples are smallpox, high hand, foot and mouth disease, and Rocky Mountain spotted fever, whereas centripetal will have the basic ones like measles, like chickenpox and roseola and all that. Okay. Okay, Alfaz Menon says, could you please repeat? Yes, brother, I would love to. I'll do one thing. I'll show you a beautiful picture, bro. This one, which we have done of the fever with rash. कौन सी बीमारी में आता है? Which topic is that? Infectious disease, no? है ना? Osama, किस में आएगा, bro? ये? Wait, I'll show you a nice picture. You'll get the whole idea. One second. IM, muscular, CP, gastro, April, immune system. Okay, infectious disease कहाँ पे है? Okay, wait. I'll show you the nice mnemonic. We have a mnemonic which we have done it before. Okay, let's quickly go open that slide. Yeah, this one. And Rocky. 1 second. Yeah. Can you see that? Can you see this beautiful picture, bro? This is a very quick answer. We must remember that one we have centrifugal and one is centripetal rash. Centrifugal, F for fugal means F for far areas, most importantly. And अपना क्या कहते हैं उसको? Yeah, the examples are as it's already written over here. Very importantly, the ये कहाँ चला गया? एक second. So as is beautifully written, Rocky Mountain spotted fever, Coxsackie virus, even HFMD also, hand, foot and mouth disease, and even अपना क्या कहते हैं उसको, smallpox also. These all are kind of a centrifugal rash, whereas अपना this chicken pox, measles, parvovirus B19, scarlet fever, roseola and rubella is the centripetal rash. The mnemonic for centripetal we have done, that is red rashes scare patients very much. Red rash is rubella, roseola, scare patients scarlet fever, parvovirus B19 very much, very saline measles. Whereas a centrifugal, at least a take home message, centrifugal matlab the distribution of the rash is more towards the far areas, F for fugal and F for far areas as in the HFMD, hand, foot and mouth disease, smallpox, Rocky Mountain spotted fever, Coxsackie A virus, साके की स्पेलिंग गलत है वो ठीक कर लेना अपने आप, ठीक है? और क्या कहते हैं, हाँ, and Rocky Mountain spotted fever, and that too this one, which is nothing but scrub typhus, which is caused by rickettsia tsutsugami, where the patient comes with fever with rash on day 5, and then it comes with a triad of fever with arthritis with palpable purpura. Palpable purpura is in ITP also, it is in scrub typhus also. The only difference is that ITP palpable purpura is exclusively in the buttocks and the lower limbs, whereas in a case of scrub typhus, it is not exquisitely in the lower limbs, it can be somewhere else also. Ooh, has everyone understood this much? Yes or yes? तुझे देखा तो ये जाना सनम, प्यार होता है दीवाना सनम. Yeah, Hannibal says, do measles commonly seen during these days? Sir, I haven't seen during Pete's posting. These days, my dear Hannibal, dengue is very common. Okay, remember that. Dengue is very common these days. Measles is not that common. गर्मियों में होता है. It's usually in summers, and not now the winters are touching and the summers are going. So mosquito is on the full motion to prick you nicely. In our house also we have big mosquitoes. I have put nice orduni and this and that. Gym में भी मच्छर है, मैंने बोला जिम वाले को थोड़ा मच्छर देखने के लिए. और क्या कहते हैं, डेंगी इज कॉमन. हैज एवरीवन understood this much on this planet. Can I move further? 30 minutes class is over, 30 minutes left. ओसामा तेरे को फोटो भेजी मैंने, वो चेक कर. या बिन तेरे बिन तेरे बिन तेरे कोई खलिश है में बिन तेरे है क्या ये जो. Yes, in the previous class we have already spoken about it, that the Forsheimer spots seen in congenital rubella infection. It's not in the rubella syndrome, bro. It is in the rubella infection. Forsheimer spots. Forsheimer spots is a very regular question asked in the exams, buddy. So you must remember that. And also at the same time that the Forsheimer R for in the Forsheimer spots we have R. So what you call R for rubella is something which you must remember. Okay, and okay, and one more thing, one crazy thing. Today, like in the end of the class, I'll ask you one question. Okay, and today's the price will be rupees 200. Like I'm gonna ask you, depends on my mood, I will ask you one or two questions. Let's see, I'll tell you on the spot, but surely I'm gonna ask you today a question, because we had a hemophilia class today, and very nice pointers I've got is there in my copy. And I was thinking when I was taking the class today, one of our professor, Dr. Gombar, he's from UCMS, and he took the class, and so it was very nice. So he told some amazing points about that thing, so about hemophilia. So I'm gonna ask you, and if you answer nicely, you can win some cute prize. Okay. Next question. Yes, we have done this before. What is the triad? What is the triad of amazingly what you called congenital rubella syndrome? I hope you know that. The triad is nothing but cafe-coffee-day, congenital heart disease, cataract and deafness. We have done this, which is the most common congenital heart disease in congenital rubella syndrome. The most common congenital heart disease in congenital rubella syndrome is patent ductus arteriosus, and that's a triad: congenital heart disease and cataract and deafness. And which is the most common manifestation? Which is the most common manifestation among the cafe-coffee-day? The answer is beautiful. Deafness is very common manifestation seen in congenital rubella syndrome. This yesterday class we have done, so I just wanted to have a quick go through so that we are beautifully benefited. This part we have done. Let's go further. This is also done, and very important, this is one extra question. 1 second. Why the upper part is visible? 1 second, brother. Yeah. Yes, so this is important. Congenital rubella syndrome is also known as which triad? So that's the beautiful answer. It is known as Greg's triad. Very, very important. Congenital rubella syndrome triad is known as Greg's triad. This I want you guys to remember forever. Okay, ये याद रखना है, ठीक है? बेइज्जती नहीं करानी है एग्जाम में. प्यारे प्यारे बच्चे हैं, प्यारा प्यारा याद रखना है, ठीक है? समझ में आ गया? Okay, great, perfect. Let's move further. I hope everyone is understanding. Yes, okay, and okay, perfect. Let's go further. Yes. Yeah, this is a good one. Good one. Which is the most common congenital heart disease in congenital rubella syndrome? That too we have done. The most common congenital heart in congenital rubella syndrome is patent ductus arteriosus. The least common. Can anyone quickly answer in the comment section, please? Which is the least common congenital heart in congenital rubella? What do you think? Most common is patent ductus arteriosus. And which is the least common, brother? So the least common is ASD. I think ASD, yes. And a double star mark. Double star mark as in, this is important, bro. Double star mark, please remember. Please update in your beautiful, amazing $1 million notes that the most common will be PDA, the least common will be ASD. Least common will be ASD. And one more question, the class cannot go missing without me asking one important question about what you called this one. ASD, in which other condition the most common congenital heart is ASD? Can anyone answer in the comment section, please? Mansi, Yogita, Osama, Karishma, Mogal, Pandey, Orion, Suraj, Suman, Priya Gupta. Atrial septal defect is in which other disease, in which other condition atrial septal defect is very, very commonly seen? Can anyone answer in the comment section? Anyone? Priya? In which other congenital heart, like koi bimari hai? Do we know any other disease on this planet where the most common is this one? Treacher colon, no. Down syndrome, yes. Down is the best answer. Isha Jan, beautiful answer. Yes, okay. Swaraj Suman, yes, right. Pandey is right. Very good. Beautiful. Are you okay? डाउन सिंड्रोम में ASD कॉमन होता है. ओके ओसामा, तुमने कहा है तो हो भी सकता है, बिकॉज यू आर रियली वर्किंग रियली हार्ड. सो डाउन सिंड्रोम, द मोस्ट कॉमन कंजेनिटल हार्ट इन डाउन सिंड्रोम इज ऑस्टियम प्राइमम टाइप ऑफ एट्रियल सेप्टल डिफेक्ट. द मोस्ट कॉमन कंजेनिटल हार्ट इन डाउन सिंड्रोम इज ऑस्टियम प्राइमम टाइप ऑफ एट्रियल सेप्टल डिफेक्ट. एंड विच इज the most specific congenital heart disease in Down syndrome is which one? Endocardial cushion defect. Very, very important. endocardial cushion defect. The most common congenital heart disease in Down syndrome is ostium primum type of atrial septal defect, and the most specific is endocardial cushion defect. Endocardial cushion defect. This is important. Please remember. Okay. So can we therefore appreciate this beautiful point? In Down syndrome, ASD is very common, and in congenital rubella syndrome, ASD is least common. In Down syndrome, ASD is the most common, but in rubella, ASD is the least common. Next question, please. Yeah, and among the cafe coffee day, which is the most commonest component, we have done deafness is the most commonest component in the cafe coffee day. Next question, please. Will they have microcephaly or macrocephaly? Yes. What do you think, guys? Will they have microcephaly or macrocephaly? Yes. Beautiful answer, please. Yeah. Okay. Alphas Menon. Yes. Alphas. You're right. Hold or M also. But no, brother. Holt or M ostium secundum type of ASD is very common. Down syndrome ostium primum type of ASD is very common. And if I talk about atrial septal defect topic per se matlab specifically atrial septal defect, if I isolated, if I talk about the most commonest type of ASD is ostium secundum type of ASD. Down syndrome, most common congenital heart is ostium primum. Holt or M, most common congenital heart is ostium secundum type of ASD. And if I talk about atrial septal defect per se, if I'm reading a cardiology topic and I'm studying ASD, the most commonest type of ASD is ostium secundum type of ASD. Please remember. Yes. Osama says endocardial cushion, also known as smooth part of the right ventricle. Yes, brother. Yes, Golu Molu. Yes, Golu, you're right. Okay, perfect. Next question, please. Will they have microcephaly or macrocephaly? Just remember, in general, most of the syndromes, if I talk about frankly, most of the syndromes usually have microcephaly. If I talk about holoprosencephaly, can you please tell me holoprosencephaly patient will have microcephaly or macrocephaly? Any random guesses? Holoprosencephaly. See, that's the beauty of this live class. We're gonna ask lot of tongue twisting, random, complicated questions, and once you answer them, the more complex instructions your brain can process and filter it beautifully, the more amazing you will be. And how it will come? It will come by practice. I have a lot of students who are saying, okay, sir, I know, but when you ask me, I forget. When you ask me, I forget. In my live classes, I take the mobile and I go live, putter like that. Who is sleeping? And the students are like looking at me like this. No one sleeps, and they're like, oh my god, this is so good. So that's what. So holoprosencephaly also you'll see microcephaly, and this syndrome also, this congenital rubella also is microcephaly. Next important point, yes, very beautifully we have done that. Yeah, that's the beauty of this part. So what are the ocular and skin lesions we see in a case of apna congenital rubella? I hope you know that. We have the salt and pepper. Kisne namak or pepper dala ho? So beautiful answer. We have salt and pepper retinopathy. Very, very beautiful answer. Please remember. We have salt and pepper retinopathy. That's another exam question. This kisne aankh mein salt and pepper dala ho? है ना? Omelette पे डालते हैं salt and pepper. Yes, exactly. Yeah. Okay. Karan says, sir, live class में सो सकता हूँ. हाँ, तू सो जा. घोड़े बेच के सो जा तू. कोई टेंशन नहीं है, ठीक है. सो व्हाट यू कॉल्ड salt and pepper retinopathy is one important ocular finding in congenital rubella. And who is this cutie pie? Let me close the eyes. Hanji, who is this cutie pie? Can beautifully answer in the comment section, please. What is this, brother? This is nothing but a blueberry. Who likes blueberry? Who let the dogs out? Blueberry muffin rash. Can you please answer in the comment section? Blueberry muffin rash. Yes. So it's like a blueberry muffins. Very important. So it's a blueberry muffin rash. ये मेरा रुमाल गिर गया. One second. It's a आज बड़ा जिम में जान निकली मेरी, तो आज शोल्डर था. Okay. So blueberry muffin rash is seen in multiple conditions, but one you should remember is nothing but congenital rubella. Yes, you're right. Savan Singh, Hanji, Savan Singh is a wonderful person, good human being. Yes, blueberry muffin rash is seen in congenital rubella. This part we have done. Yeah, it's a beautiful picture of blueberry muffin. Remember that. It's important. Another picture of blueberry muffin rash. Hanji, can you please answer me? Which color cannula is this? Yes, anyone answer in the comment section. Which color cannula is this? Hanji. और गलत आंसर दे के दिखाओ बेटा. शुभम कहाँ पे है? शुभम, कौन से कलर कैनला है ये? Which color cannula is this? Which color cannula? Anyone? Okay. Karan says, sir, Mother Dairy का yogurt बहुत tasty होता है. Oh, yogurt, I also like yogurt. यार, I also like yogurt. It's nice. I like strawberry yogurt. I like mango. Stew I had strawberry and mango. Vanilla I had once. हाँ जी. Okay. which अच्छा कलर तो है ही येलो ही है. Yellow is which number cannula? Yellow is which number cannula? Can anyone answer in the comment section? Suman is cute. Suman is putting one yellow color only directly. ये बिंदी माथे पे लगा लो तुम येलो रंग वाली. हाँ जी. Yeah, Shraddha Pal is right. Suman is right. Karan, Osama, Priya, Suraj, amazing. Yellow is 24 number cannula. That's very well put. And which is 26? 26 कौन सा होता है? Which is 26? Yes, 26 is purple. 26 is purple and 22 is blue. 16 gray, 18 green and 20. अयो फिर गिर गया. क्या कहते हैं? 20 कौन सा था? 20 was pink. I hope you know the colors. No, we have done it. I hope you have done it. Yes, exactly. Okay. Mahesh saying sir गौतम नगर की क्लास में कोई भी आ सकता है. हाँ, कोई भी आ सकता है. भैंस, गाय, बकरी, बछड़ा सब आ सकते हैं. कोई टेंशन नहीं है. ठीक है. हाँ जी. या I hope you know the colors and the names. I'll not repeat. If you are weak in that, let me know. I will what do you call, let you know. हाँ जी. ओहो, Karan says 28 lavender. अच्छा lavender. Strawberry भी होगा कोई color. देख ले तूने बनाया होगा एक कहीं गलती से. Suman, that's very cute. Thank you, dear. Next question, please. How do you diagnose congenital rubella? Yes, let's finish this topic today. Congenital rubella, Hanji. How do you diagnose? How do you diagnose? How do you diagnose toxoplasmosis? Remember? Anyone remember? See, link and study, bro. How do you diagnose? Bola na. So finish 5 diagnoses. How do you diagnose congenital toxoplasmosis? By IgM. No, IgM antibody you tend you check, right? And yeah, how do you diagnose congenital varicella? I hope we have done that. So we have this anti-varicella zoster virus antibody. That's how we diagnose varicella syndrome, by checking this anti-varicella zoster virus antibody. Toxoplasmosis by IgM antibodies. And congenital rubella, how do you diagnose? Again, IgM antibody. Once we have an infection, antigen comes in our body. Against that antigen, antibodies are formed, and we have two types. We have IgM antibody and IgG antibody. IgM antibodies, they always jump in the acute infection, whereas IgG antibodies are there in the chronic or the late infection. So IgM antibodies in the fetal blood is something you should remember. Next topic, please. No, खत्म हो गया. Has everyone understood this much? Please let me know and tell me how is this new cup. We have this very beautiful cup. It has a black color. It has a blue, this different orange color. Bonmita. I am a Bonmita wala boy. Which chocolate shake? Which do you guys take milk? How many of you don't drink milk? Please let me know. Great, that's right. Great. How many of you take milk? Please let me know. The options are yes, we do take milk. The option is no, we don't take milk. Please let me know in the comment section. Quick answers, please. GM, G se ganda, M se hardworking. Cute. Okay, Dr. Suman, she takes milk. That's very good. Okay. Adikya Adi says, sir, your hard copy notes will be available? No. There is no hard copy notes. I apologize. There is no hard copy notes. Anyhow, we're gonna have this Cerebellar Academy. I have joined with Dr. Apur Mehra, Dr. Govind Rai Gargi, and some amazing people. They're, kind of, what do you call, we might have a small workbook. It'll be easy, good for you. Okay. Suman says, born meetup you, jeet ki tiyari karo. That's true. I recommend everyone to have lot of milk in the day. Shubham, kitna doodh pita tu? Dharmendra, okay, he drink milks. Very good. Swaraj, Suman, Hanji, Grace, buttermilk. Not buttermilk. Buttermilk, I also take in the sun in the noon time when it's too hot there in our hospital. But I recommend one milk in the morning, one milk in the night. Everyone should take. Will you guys take milk? Yes or no now? Please, I recommend everyone to take a lot of milk. It's good for your health. It's good for your body. Your proteins is really good. It's good for your this one. It's good for your biceps. It's nice. Please take milk. Oh, Tanmay, direct answer. I'm lactose intolerant. Okay. Now that's one thing to talk about. Lactose free formula milk you take then, but don't stop milk. That's important. Okay. Yes. What? So Dr. Savan Singh says 1 to 2 glass a week. बेटा तू जान से मार दूंगा तेरे को मैं. तू बाहर मिल, 2 गली छोड़ के रहता तू मेरे घर से. पता नहीं तेरे को. दूध पीना चाहिए. दूध पीना चाहिए. Dr. Karan says boost is the secret of my energy. Okay, boost is secret of energy घर पे, रूम पे नहीं, क्योंकि मैं दूध नहीं ड्रिंक करता हूँ. गंदी बातें करा लो बस, ठीक है. So cytomegalovirus, brother, can you please tell me cytomegalovirus, what's the special thing I should talk about? We have done this before, my dear. The most commonest congenital infection among the torch is CMV. Cytomegalovirus is the most common congenital infection. It's very well written in OPK 9th edition. And what is the beautiful characteristic of cytomegalovirus? We have done that before. That's very important. That can you see that, brother? This white deposit which are around the ventricles. Can we appreciate this point, brother? This ये white dots कहाँ पे हैं? Where are these white dots? They are around the ventricles, brother, and that is known as periventricular. This is known as periventricular calcifications. I hope you remember that congenital toxoplasmosis will have a diffuse intracranial calcifications, whereas what you call upon the cytomegalovirus will have a periventricular calcifications, and the triad will be same. You will see hydrocephalus in CMV. You will see what you called chorioretinitis in CMV, but in the diffuse calcification, the toxoplasmosis will have an intracranial diffuse calcifications, and cytomegalovirus will have around the ventricles calcification known as periventricular calcifications. Done. Next topic, please. The next bit of, yeah, exactly, this we have done. Toxoplasmosis has diffuse intracerebral calcification and CMV has periventricular. This part is done. Yes, good question. Yes, this was already an exam question. The most common long-term sequelae associated with congenital CMV infection. Any random guesses you want to talk about? Oh, so पहले Karan ने बोल दिया. Karan has already told the beautiful answer. And this one, deafness. Deafness is frankly speaking in so many conditions. If the mother has taken anti-malarials during pregnancy, the baby can have deafness. In congenital rubella syndrome also, the most commonest manifestation is deafness. Here also the most commonest अपना क्या कहते हैं what you called the most common long-term sequel in cytomegalovirus infection is deafness. So by that, what is the moral of the story? The moral of the story is whenever you're expecting a torch profile, whenever you're expecting a torch infection in the mother or in the baby, make sure you get the ENT evaluation. ENT and ophtha evaluation. I remember when I was in Lady Harding, a lot of babies used to rule out for torch infection, and the first thing we used to say is that get a ENT opinion, get a ophtha opinion. Ophtha for chorioretinitis and ENT opinion for deafness or any kind of sensorineural hearing loss, because this torch infection babies definitely will have chorioretinitis in the eyes and or deafness in the ears. And deafness is like, as you can see in multiple places, deafness, ear is something which is very much involved in a case of what you called apna this infections. Okay, even meningitis also. I remember I read one MCQ for MRCPCH, and they were saying a patient was having meningitis and he was given 14 days antibiotic, he was discharged, but the mother was complaining the child is very disruptive. It was a very nice question. MRCPCH questions are really good. I'm soon starting MRCPCH classes because the syllabus which I did for MRCPCH has so classy questions. It's just that I'm not getting time, otherwise it was awesome. They were asking that a patient of meningitis was given antibiotics for 14 days, like lumbar puncture was done, meningitis was detected, and antibiotics were given for 14 to 21 days. The patient was going to get discharged, but the mother was complaining the child is very disruptive. The child is very disruptive, or I would say destructive. मतलब समझता ही नहीं है. Doctor, he has become a little strange. He's not understanding what I'm trying to say. So what is the answer for that question? The answer for that question is like this ENT opinion, otitis media infection, deafness, all these ENT issues a post meningitis patient usually have. That is why, remember, when you become amazing, beautiful, mind-blowing, super amazing doctors as MD physicians, MD medicine or pediatrician, make sure any meningitis patient or any torch infection patients, ENT opinion and ophtha opinion is must, because ENT opinion, deafness or otitis infections are very common post meningitis also. Has everyone understood this much? Yes or no? Karan says, sir, मुझे please add करना. अच्छा, आज रात वाले में 10:45 को we gonna go live, not live as in, but we gonna chat on WhatsApp group call. Shubhangi, Osama, Shubham, I think Manish will also come, and yesterday also they had come, they were waiting for me, and today once I finish the class, I'll go have food, then I'll go take Oscar for a walk, and then 10:45 once I come back again to study in my study room, then 5 minutes ke liye I'll directly come online, and then we can talk for 2 or 5 minutes. It'll be fun. Next question, please. Yeah, hearing loss is important for post CMV infection. How to diagnose cytomegalovirus? That's another crazy question. Remember that. How to diagnose cytomegalovirus? Very beautiful answer. This has already been an exam question. So we have cytomegalovirus polymerase chain reaction. We have CMV PCR. We have CMV PCR. This is the test known as CMV PCR, and the best sample is urine. The best sample for diagnosis. See, all the other are blood samples actually, but in the case of cytomegalovirus, the CMV PCR is the best method, and the best sample is taken as urine. And this is already an exam question. And remember, so if you're doing a newborn screening test for cytomegalovirus, then saliva is the best sample. I'll repeat again, there are two things: either you take the saliva or you take the urine. In which case you'll take the saliva, in which case you take the urine. If you're doing a newborn screening test and you want to rule out CMV, then saliva is a good option. But otherwise, when are you going to take urine? If you're planning for CMV PCR, then the best sample is urine. CMV PCR sample, the best sample is urine. In a case of newborn screening test, the best sample is saliva. That you should know. And ganciclovir and vulganciclovir, like because cytomegalovirus, so virus, so antiviral, acyclovir, ganciclovir, vulganciclovir. So ganciclovir is something which is important for us. And yeah, this was this one, and this was the AIMS question. Now see this directly. That's a good part again of the live classes. Theory followed by MCQ. Theory followed by MCQ. This was the MCQ. A child came with microcephaly, hepatomegaly, periventricular calcification. Best site from where specimen should be attained for CMV infection by PCR. PCR, such a beautiful question, bro. Can you understand this question? See, that's what your eyes can't see, but your brain doesn't know. Your eyes can't see, but your brain doesn't know. Are you understanding this beautiful point? Examiner is giving you very clear-cut, beautiful answer. Examiner is saying periventricular calcification that only happens in CMV, and they are saying that which sample should be attained for CMV infection by PCR. If polymerase chain reaction sample like PCR technique I am supposed to do, then what's the best sample for that? The best answer for this question is nothing but urine. Urine sample with the best answer. Urine would be the best answer. And newborn screening test, that would be saliva. Has everyone understood this much? Yes. Please let me know. हंसते हंसते कट जाए रस्ते, जिंदगी यूं ही चलती रहे, खुशी मिले या गम बदलेंगे ना हम, दुनिया चाहे बदलती रहे. Yes, in congenital herpes, as we all know, we are coming to the end of the topic. This topic is finished. Now we have a test. And the first prize will be rupees 200. And I have some. This is my notebook, classmate. Ayyo, I'm still a child. I think I'm a child only, seriously. And I want to share one thing with you. I have seen that I am very attached to children, like this pediatric, children. As in, when I go to the ward, I am like chit-chatting with children, like small babies, 2-year-old, 1-year-old, 4-year-old. It's fun to talk to them. They are very comfortable talking. They are not selfish. They are selfless. They are comfortable to talk. And again, another one place I go and talk is like gym. In the gym, I have this, again, I was told, this 18-year-old, 17-year-old, 19-year-old, BCom first year, BSc first year, just finished 12th class. Lambe, 6 feet of boys and girls we have. And they are so good to talk, and they are like very emotionally attached and very, very good by nature. They are not selfish, because that 18-year of life, when you were a first year MBBS student, you like, it's like a budding age. So you're like very fresh, like a fruit. You are budding, you're like a fresh fruit. You come 28 and 30, you become a rotten fruit sometimes, I feel, because like kind of life shapes you. Do you agree with me? Life shapes you, but that depends on you. How do you want to get shaped? Do you want to get irritated by nature or by time? Do you want to get fussy by time, or you want to get better by time? There was a beautiful saying, don't be bitter by past, be better by past. I hope you have heard this beautiful saying, bro. They कहते हैं कि don't be bitter by past, be better by past. Do you agree with this line? Yes or no? So that's what, there are people who tells me, no sir, my past was very hard, sir. You have no idea कितना संघर्ष किया मैंने life में, how much hard work I have done, sir. That's why I have become very bitter. So please, bitter or better, it depends on you. Once you move in life further, be better, be amazing, be beautiful, be gorgeous, be positive, be like a shining soul, be so charismatic that people should crave to be with you. That's life is. People should crave to be with you. And that's what happens in my life also, which frankly I have seen, and that's been a very blissful time. Let's have दो खाऊंगा. So that's what. So that's beautiful. In gym also, people want to come and talk to me. It's a good feeling. It's a good feeling, and I don't expect. So it's a good thing. हाँ जी, कहाँ थे हम? अच्छा, यो बातें खत्म नहीं होती. Next question, please. Yes. So that's what. So in the yeah, this part is over, and the herpes also very importantly, as you know, that congenital herpes, no, is like a skin, eye, and mouth disease. Like we have this hand, foot, and mouth disease. So herpes is like a skin, eye, and mouth disease. Yes, doctor. Yes, Dr. Suraj. So skin is herpes affects the skin, the eyes, and the mouth. That you should know. And how do you prevent herpes? By elective cesarean section. So that's another very important. Do you remember I told you in the delivery? In the delivery, some infections are very important. H for HIV, H for HIV, and H for herpes, and H for hepatitis B. Do you remember, guys? Yes or no? So three infections are there, which is like very crazily touching the baby during the delivery. If the baby mother is HIV positive, then obviously the baby should be on the nevirapine once the baby is born. You know that. If the mother is what you call hepatitis B positive, then you know already we have done yesterday some amazing MCQs from AIMS protocol 2022 guidelines, which says that baby should be given hepatitis B immunoglobulin and hepatitis B vaccine if the mother is hepatitis B positive. And now coming to the herpes, the mother is herpes positive, which is nothing but like a skin, eye, and mouth disease. Elective cesarean section. Quietly do a LSCS, lower segment cesarean section, and be happy in life. That's what you should do. That's what you should do. Okay. शुभम, तू मार खाएगा हमसे. शुभम कह रहा है पराठे सर जी कौन से आज लस्सी के साथ. दिस माय भाभी इज ऑर्डरिंग फ्रूट फ्रॉम आउटसाइड, सो शी टोल्ड शी नोज दैट आई लाइक लच्छा पराठा एंड दिस वन आई लाइक गार्लिक नान. हाउ मेनी ऑफ यू लाइक गार्लिक नान? प्लीज लेट मी नो इन द कमेंट सेक्शन. गार्लिक नान इज गुड, सो इट्स गुड. सो लच्छा, डू यू लाइक लच्छा पराठा और गार्लिक नान? प्लीज लेट मी नो इन द कमेंट सेक्शन. हेलो. ओके शुभम. ओके यस. जिम्मी वॉकर नहीं, जिम्मी अमुका, आई थॉट जॉनी वॉकर. ओके सुमन, हाँ जी राइट. प्रिया गुप्ता राइट. सुमन राइट. करण राइट. ओके सर मिस हो गई. क्या मिस हो गई डियर? क्या मिस हो गया? Karan is also very funny. Yeah, this part is done, and that's what. And as I'm talking about the herpes of virus, then of course acyclovir, like intravenous IV acyclovir treatment sounds a good option. Yeah, exactly. So Suraj Kumar says, sir, is cesarean section facilities not, if cesarean section facility is not available, then don't we have some drug to control? Yes, buddy, we have acyclovir. We have some amazing drug that is acyclovir, which is important in a case of herpes, and show to dermatologist also. He'll be helping us out, dermatologist. Okay, yes, I got the test. Today's price is 200 rupees, better price. अच्छा और क्या? Oh, that finishes this class. That finishes this class. That finishes this class. That finishes this class. This will do it in the next class, because in this option multiple options are correct. Yes. Now coming to this class is over. This week has come to an end. Okay. Okay, Shubhangi, I got your message. Okay, bro, no problem. And Dr. Jimmy says, you are amazing, Dr. Anand. I am nothing without your support. That's very kind of you. Let's quickly start off. The class has ended now. Thank you so much for the love and support. Osama, बहुत दिन हो गए, एक बढ़िया सा यार शायरी देख ले अगर कमेंट में आती हो तो. Now I have a okay, I have a quiz. Now the time for quiz. Okay, the time for quiz. Okay, are you ready? Yes or no? Okay. शुभम बड़ा प्यारा है. शुभम सेज, सर ट्राई सैलेड डेली रेस्ट्रो. कौन से वाला है ये? विच वन इज दैट ब्रो? ओके, ब्रावो है ना? Okay, yes, okay, great. Quiz. So are you ready? The first prize is rupees 200 Paytm back to back within 5 minutes. I'll do it Paytm to you. Okay. So सब गाते हैं, सब ही मदहोश हैं, हम तुम क्यों खामोश हैं, साजे दिल छेड़ो ना, चुप हो क्यों, गाओ ना, आओ ना, आओ ना, आओ ना, आओ ना. Okay, 1 second. Okay, I have a question. Are you ready? Okay, 1 second. Let me ask you a tough one. I'm gonna ask you. Okay. हाँ, ये बड़ा अच्छा यार, क्वेश्चन बड़े प्यारे हैं एक्चुअली. ओके, क्वेश्चन नंबर 1. या ओके, आर यू रेडी? ठीक है, बेइज्जती नहीं करानी अपनी, ठीक है, अच्छे से आंसर करना, डू इट नाइसली. ओके, Thank you, Karan, brother. Thank you, brother. Lots of respect from my side. Thank you. Okay, this wait, Savan, क्या कहते हैं? Okay, question number one. Listen very carefully. The rules of this test are, there are some rules. Can we talk about rules, please? Yes. So there are some rules. Okay, I'll ask you one question. You have to answer in one proper single answer format. Don't answer like, something, then something, then something. Try one proper full answer, then put your enter button in your mobile and laptop. Okay, listen very carefully, and I'll take the screenshot also who is coming first in my comment section, so that there is no conspiracy later. Sir, I told first answer, you gave her the first prize. So I don't want that, all that parvachan. Okay, yeah, question number one. Savan says rules are there to break. I'll break your bones, meet me outside the gym. Okay, it's very easy, but question is nice. Okay, the first, listen very carefully. The first question is desmopressin. The question is, desmopressin is used in three conditions in pediatrics, three conditions. In one single full answer, not in bits and pieces, one single full answer, tell me desmopressin is the drug of choice, or I would say it is used, not the drug of choice, but used in three conditions in pediatrics. I want one full answer. If you answer just like one by one in the comment, I'm not going to take it. One full answer that desmopressin is used in three conditions in pediatrics. Don't write one answer, then one answer, then one answer. I'm not going to take it. Your time starts now. प्रिया गुप्ता होती तो अच्छा आंसर करती. Okay, okay, Osama, जितना आता है बताओ. Whatever you guys know, you tell me. Okay. 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 1 second. Okay. Okay, done. Yeah, I have taken the screenshot, and I think 1 second. किसने आंसर दिया? Karan. Karan has the best answer. So as you all know, very, very important, that desmopressin, of course, everyone knows the first is used in nocturnal enuresis, that everyone knows about it. Desmopressin is used in nocturnal enuresis. Second, desmopressin is used in diabetes insipidus, which Karan has told very good. Diabetes insipidus, desmopressin is used. And one very beautiful drug, like condition, hemophilia, in a case of hemophilia. So at least three questions, one answer. It's a very beautiful point. Like in hemophilia, use desmopressin. I just got to know recently. I forgot that point. So hemophilia, the desmopressin is used in nocturnal enuresis, hemophilia, and diabetes insipidus. Question number two. Question number two. Let's see if Karan only wins the show. Let's see. It's just a question. Again, very easy. Very easy. Tell me three conditions. Tell me now. All this also is three conditions only. You have to tell me. Okay, three conditions. Condition number one, condition number two, condition number three. The question is, tell me three conditions. अब करण थम जा तू. हाँ, पता है मुझे, देखा मैंने. करण शांति रखो. You, according to me, you are the winner. I've taken the screenshot. Next question. Tell me three conditions in pediatrics where, as a treatment, the route is intranasal. Your time starts now. Any three conditions in pediatrics where you use intranasal. Write the answer in one single format and tell me. Your time starts now. Intranasal. What all? Tell me three conditions, three random things in pediatric which are given intranasal. Intranasal. Okay. भावना मनकार. Okay. पर कोई बात नहीं करण, तूने पहले दिया और तेरा ठीक था मेरे हिसाब से. ओके, हेमलता, सावन, ओके, जॉनी वॉकर, प्रिया गुप्ता. प्रिया आ गई दोबारा. प्रिया, ओके. Priya has cute answer actually. I don't know whom to give the prize. Okay. So this question, I think Priya has won, and Priya has told, let's say Priya told that, of course, in a case of seizure, yes, Priya is right that intranasal midazolam is given in neonatal seizure. That's true. H1N1. The influenza vaccine H1N1 is given intranasal. Even in simple coryza also, sometimes we give intranasal drops. I agree with you. Normal saline nasal drops, Otrivion nasal drops, pediatric normal saline nasal drops. So Priya Gupta had taken the screenshot. Priya Gupta is right actually, frankly. In seizure, in the febrile seizure, we give rectal diazepam or intranasal midazolam. That's right. In vaccines, H1N1 vaccine is given intranasal. That is right. For coryza, you give normal saline nasal drops, or even this fluticasone nasal drops if you want to talk about steroids. So there are many things actually given intranasal, which in coryza, that's very well right. I would like to add extra points. COVID, even the COVID vaccine also as everyone knows, is the trials are going on, and it is intranasal COVID vaccine has come. And one more, again, a same beautiful point in hemophilia, desmopressin again is given intranasal. There is an option of given in hemophilia, the desmopressin, the drug, and that desmopressin actually is given what you call it intranasal. Okay. Nee, Dr. Osama. Hello, Dr. Osama. This nasal, which very beautifully you have told, that the question would be, what are the drugs given intratracheal? If I ask you intratracheal drugs, yes, Osama is right. The mnemonic is nasal, naloxone, adrenaline, surfactant, atropine, and lignocaine. That's right. But intranasal is H1N1 in the coryza, in the COVID, in desmopressin, and in seizures. Okay, now a tie. Now a last question. That the tie is between Priya and Karan. अच्छा Karan तो चला गया इधर. Karan मतलब है मेरे उसमें चला गया. So the tie between Priya and Karan. Wait, let me just update what the extra points are. I also love to update in my notebook. Intranasal COVID is over. Seizure also you give intranasal. That's right. What else? Anything else? Coryza. Okay. Good. I've got 5 conditions now. 1, 2, 3, 4, 5. I feel very happy once I add on my knowledge. You know, that's the beauty of like the brains. In the morning, I got this special point, just extra little points I got, and the first thing came to my mind, I will share it in the class. It's a good knowledge. Let me share it. That's like the first thing when someone told me these points, I was like, oh my God. आज शाम को class 8:30 I'm going to share this beautiful knowledge. So will you guys remember, my dear? समझ में आ गया? So desmopressin is given in hemophilia, diabetes insipidus, and nocturnal enuresis. And intranasal drugs are COVID may you give intranasal neonatal seizures. You give intranasal midazolam. In H1N1 influenza vaccine can be given intranasal. Is given intranasal. Desmopressin in hemophilia is given intranasal. Now there is a tie. Last question. The class is over now. Is everyone understanding? Yes or yes? Yes. There is a tie between Karan and Priya. Only 2 people are like the prime members, and everyone can answer, of course. Has everyone understood? Yes or no? Okay. So now क्या बोलेगा? करण क्या कह रहा है? Same here at Raj Suman. सोच रहा हूँ सर का नोट्स कैसे चोरी करूँ? Yeah, Suman, you are a girl, no? सोच रहा हूँ कैसे you wrote? You wrote सोच रही हूँ. Dr. Suman should write सोच रही हूँ. You only told me you are a girl. I thought you are a boy, Suraj. Okay. सर को ही चोरी कर लेते हैं. Oh ho. Okay, Dr. Faizan. That's $1 million point, brother. Yes, दोस्ती कर लो, प्यार अपने आप ही हो जाएगा. Can we have the last question on the stage, please? A last question, and either the prize winner will be Karan or the prize winner will be Priya. Let me see the question once again. I have 2 nice questions actually. Let me check. Okay, yes. Okay, that's true. That's true. Yes. So I have this beautiful question. Let's see if anyone can answer. Okay, yeah. The last question, which will define the winner, is. Yeah. Should I ask? Yeah. So if we come to the difference of the fresh frozen plasma and the cryoprecipitates, I'll repeat again. Listen to the question. If I come to fresh frozen plasma and cryoprecipitates, yeah. The question is the difference, like what is the difference between the fresh frozen plasma and cryoprecipitates in terms of factors? Like, you know, we have factor 7, factor 8, factor 9 and all that. If I talk about fresh frozen plasma and if I talk about cryoprecipitates, what is the difference in terms of factors? Like if I have a von Willebrand disease or hemophilia, what will you prefer? Will you give me FFP or cryoprecipitates? That's the answer. The Question is dedicated to Karan and Priya. Let's see if you can answer this straight away question. The one answering better, of course, is the winner. Karan and Priya. Okay. Osama says color. Cute. Cute answer. Cute boys answer cute babies answering cute. पर ये सही आंसर नहीं है. अगला Priya Gupta. Okay. Henna Bird. Yes. Okay. Karan. I think yes. So, okay. I think Priya Gupta has told the right answer. Priya Gupta is winner for me now. Priya Gupta has told this answer. Priya Gupta says, and that's right actually, fresh frozen plasma have all the factors. Fresh frozen plasma contains all the factors, whereas the cryoprecipitate has actually exclusively factor 8 is there. Like, does cryoprecipitates contains all the factors? No, it does not contain all the factors. Fresh frozen plasma has all the factors, and today Dr. Gomber told my professor told me that because he's a hemato-oncologist and they give factors like Prashad. So they told that fresh frozen plasma has all the factors, whereas cryoprecipitate has a very exclusive point of the factor 8 as a cryoprecipitate. Yeah, that's it. And yeah, that's it. Yeah, exactly. That finishes this class. And Dr. Priya is the winner. Can we please congratulate Dr. Priya? Yes or yes. Please, a huge congratulations to Dr. Priya, please. Everyone, Priya is really winning the show. Nowadays, Priya is answering really good. Dr. Priya, you win this beautiful rupees 200. Paytm, I'm going to do it. अभी मुझे WhatsApp कर दो, फिर मैं खाने चला जाऊँगा, मैं भूल जाऊँगा. Yeah, exactly. Okay, Karan says, Dhoom. Where is Priya, ma'am? Congratulations. Yes. And good, Karan. I'm really happy you take the quiz very wisely and very positively. And I like people who take things very positively. So it was a quick discussion. It was a healthy talk. And thank you. I hope you guys have understood something. And if you're a newcomer, we have this beautiful WhatsApp and Telegram group. My mobile number is 9999897081. You can come and I'll put you in our beautiful WhatsApp and Telegram groups. And luckily now, before my groups had 257 as the maximum capacity, and now it has increased to 512, and that also is filling really fast. So thank you so much everyone. Karan, great. Shraddha, beautiful. Rajkumar, Osama, Faizan, Raza. Thank you so much everyone for this beautiful participation. This was the last class of the weekend. Saturday, Sunday, we're not going to have any class. And Monday, accordingly, I'll tell you, I think we should have a class on Monday, but let's see. And thank you so much. Please take care of yourself. A lovely evening to everyone. Has everyone understood? Yes or yes. Faizan ने कुछ लिखा है. एक second. Great. कुछ रह तो नहीं गया. I'm just checking the comments. कुछ रह ना जाए भगवान की दया से. एक डर मुझे है वक्त सता रहा है, ये बेमतलबी इश्क अब मतलबी होता जा रहा है. एक डर मुझे है वक्त. अच्छा, okay, great. So before leaving, we have this beautiful quote by Dr. Faizan Raza, which I'm going to quickly tell about Dr. Faizan Raza quotes, which is very beautiful. He says that एक डर मुझे हर वक्त सता रहा है, एक डर मुझे हर वक्त सता रहा है, ये बेमतलबी इश्क अब मतलबी होता जा रहा है. So that's a very beautiful quote. Very good. और फैजान, proud of you. उम्दा प्रदर्शन. एक डर मुझे हर वक्त सता रहा है, ये बेमतलबी इश्क अब मतलबी होता जा रहा है. Ooh, that's heart touching. Great. Thank you so much everyone for this beautiful participation. Dr. Aribam says it was really amazing class, sir. Thank you. Danka means thank you in French. Thank you so much in German. Yes. Thank you. Bye. Take care and see you soon on Monday. Be happy. Life is beautiful. Take care. Bye everyone. Study well.